universities. What are the conditions under which you feel would be good for them to reopen?
I think the conditions include looking at the number of cases that are emerging in an area at a given period of time. We know that this is a very fluid situation. And while children and young people themselves oftentimes are not that ill from the coronavirus infection or may be asymptomatic carriers, we know that they're in contact with adults, many of whom have medical conditions that make a coronavirus infection very serious for them. Testing capacity in communities is also important. And very importantly, we've seen during this pandemic and here in the United States, we've really seen the impact of healthcare disparities. We know, for example, that the hospitalization rate is 4.5 times higher among blacks and the Latinx community than among whites. And there's a disproportionately high mortality rate among underrepresented groups. All those are factors that are going to have to be taken into consideration by local communities as they face this very important decision about whether to reopen schools and when to reopen them.
Kelly?
I guess my question, Doctor, is how much confidence do you have about some of the recent treatments that have been described in the progress towards a vaccine? I mean, are we all going to have to wait on that big breakthrough announcement someday, or can heavy reliance on masks and social distancing continue to reopen the economy?
I believe that masks and social distancing are effective at preventing the infection with the SARS-CoV-2 virus. We have to use them, though. They're not effective if the mask sits on the shelf. There is a lot of progress being made in therapeutics, both with monoclonal antibodies, with other therapeutics that are being now engaged in clinical trials to determine their efficacy. And progress on the vaccine, or multiple vaccines, is proceeding, I think, at a prodigious pace. I believe it's very likely that we'll have a vaccine or multiple vaccines through phase 3 trials by either the end of this calendar year or early part of 2021. Then there'll be the problem of, or the challenge of, how to allocate those doses of vaccine and how to distribute them.
Are you surprised at this wave that has hit now these hotspot states like Texas and Florida? Was it inevitable? Are we blaming the people who live in those states for this happening, or was this just a part of the process of a global pandemic as it sweeps across the globe?
I don't think it was inevitable, but it certainly underscores the importance of observing social distancing, of wearing masks, of opening businesses in a very prudent fashion by making sure that people in businesses are distanced from one another, that people are wearing masks as they should be. When those precautions aren't taken, then we see situations as we are now seeing in Florida, in Texas, Arizona, and yes, here in California as well.
One related question to that, and to, again, the preventative measures, Doctor, we can keep taking. What do you think about, we're hearing more about air filtration systems as it relates to restaurants and movie theaters, and I heard people who were traveling up on the Amtrak train over the past weekend say that they were told their air is freshly circulated every 7 minutes as they're making their trip. You know, are those factors really going to make a difference? Are they an important part of keeping us safe? A really important part? And if so, should they be more or less required, even though it's, you know, it's a huge cost for some restaurants in particular, but is it something that should really be a part of our toolkit here?
I think they should be a part of our toolkit. You're right, the economic factors certainly come into consideration, but even air filtration and the measures you mentioned, those still do not remove the need to wear masks and to observe social distancing in settings like restaurants, as well as in confined spaces like a train car or an airplane.